My name is Dr. Adedunni Olusanya. I'm a senior lecturer at the Department of Pharmacology, Therapeutics and Toxicology, College of Medicine, University of Lagos, and I'm also a neurologist. My research work is on the use of Lagos Cognitive Tool, a self-administered online tool for the measurement of cognitive changes. The tool is focused on detecting early changes in cognition. Dementia is common. About 50 million people have dementia globally, and it's projected that this number will triple in the next 3 years. The problem with dementia is most people present at the advanced stage of the disease when little or nothing can be done. So the idea of the tool is we want to create a tool that people can easily access online in their homes, a tool that can be used in the hospitals to detect early changes in cognitive function so that interventions can be made early, and we hope to reduce the prevalence of dementia by early detection, which our tool would offer. The two main objectives: one is we want to create a tool that will detect changes in cognition early so that patients will come to the hospital and seek medical care. Then we want to develop the same tool to monitor changes in cognition. So if there's a drop from the baseline, you know something is wrong and you can intervene early. So far, we've been able to develop the tool. We've deployed for ease of use, a lot of back and forth, and we've adjusted the tool so that it can be easy to use by the audience. Then third, we've done a reliability testing. That was what we did. Was the first week at baseline, we administered the tool. At 2 weeks, we re-administered the tool. So we compared the scores between the first and the 2 weeks, and the scores were essentially the same. We compared to another tool which is used internationally, which is not very adaptable in our society, and realized that our own was more reliable compared to the international tool we compared to. Presently, we are deploying the tool to a larger population of people. We are looking at 250. We have about less than 100 people to go. We are making progress. Okay, I would say the funding has really helped, because without the funding in the first place, we wouldn't have started this. We needed the funds for the software development, for the recruitment of people, for all the logistics. And of course, we'll need to publish and disseminate the research. So the LASRIC funding has created the opportunity to be able to do that. Thank you. Okay, like I said, dementia is a global issue. It's increasing globally, and I didn't mention it's projected that the increase in dementia rates will come from developing countries like Nigeria. But we are not prepared for this. So we believe by the time this tool is deployed, it will help in the early detection of dementia, and it will eventually reduce the burden of the disease. Yes, I have. I've had to work with people who are into software development. I've had to work with people who are into language function, people who studied Yoruba. I'm trying to work with people who understand Pidgin English, because we are planning to work on the Yoruba. We've started working on the Yoruba version and Pidgin English version. So that has really helped. Of course, I've met people in the community who have had family history of dementia, who are really enthusiastic about developing this. So I've met professionals in the same field, I've met people in other fields, and I've met people in the community who are rather enthusiastic about this. We are planning to, after this initial phase, by the time we establish the normal scores for people who have normal cognitive function, people who have reduced cognitive function, we are planning like a 3 to 5 year study in which we recruit people over time and see, oh, this is the trajectory of the score. So we could say that people who have whose score dropped from 10 to maybe 8, theoretically, are likely going to develop dementia compared to those people whose scores are relatively stable over time. 2, we plan to make this available to other researchers so that we can have baseline studies across different communities, so that we can use that to establish a baseline score, so that maybe there are racial differences, and environmental differences, tribal differences, and all of that. So we plan to collaborate with other researchers. I think those are the main areas. Like I said, this question is futuristic. So when we get the results, we hope to present this at scientific conferences, especially conferences that deal with neurological diseases, conferences that deal that are geared towards the older adults. That we intend to publish in peer-reviewed journals, both locally and internationally, especially in the African setting. After we've established the normal baseline and all we need, we plan to make this available online. We're going to create a website, check your memory function, check your cognitive function from time to time as a token to the general public. Then we also want to plan to collaborate with different hospitals so that it will be part of their baseline assessment for older adults from maybe 50 or 60 years and above, so that they can do serial measurements, and if there's a change in their memory and cognitive function, they can get to work for early detection and treatment of the condition.